Good morning, good afternoon, good evening. Happy Easter to those people who are celebrating Easter. I am celebrating Easter. Today is a wonderful day. I just thought, though, we cannot not come here because it's a beautiful place that I always come up with all these wonderful speakers I bring along. Today we have a beautiful topic that I think it's important for us to talk about. We're going to talk about cataracts, but before we do that, I'm going to introduce my speaker here, my guest shortly. Today I want us to talk about diabetes. Diabetes mellitus is a global medical condition. And actually, as we are continuously eating the way we eat or we live the way we live, we're going to see more and more people living with diabetes. And actually, Dr. Marcella here can agree with me. We're starting to see even type 2, which was in the past was for adults. It was adult onset diabetes, but we see it now in children as young as 12 because of children's obesity. Before I waste our time, I don't want to do that. I want to introduce our guest here, Dr. Marcella Labelle. She's an optometrist for over 20 years. Here in Calgary, she lives here in Calgary area like me in Canada, Western Canada. She's been an optometrist for over 20 years, and her specialty, her passion is on cataracts. And cataracts actually is one of the complications we see in diabetics and also other conditions. Today, she's going to take a deep dive on how to prepare people because, we send our patients to the optometrist, to the ophthalmologist, without realizing the impact cataracts have emotionally. Mm-hmm. So don't worry, today she's going to take us through that. Welcome, Doc.
Well, thank you so much for having me here. And yes, we have a lot to cover. Let's go right into the diabetic connection to cataracts first. And then we're going to back up a little bit and talk exactly what a cataract is. But I want to grab your attention right away, because if we're talking about diabetes, and we're talking about cataracts. Cataract is the leading cause of blindness in the world. And diabetes is directly connected to it. In fact, you're 2 times as likely to develop cataracts if you have diabetes. And even worse, the younger you are, the more likely you are to develop a cataract. So the longer you have diabetes or the less controlled you are in your blood sugar levels, the more likely you are to develop a cataract. And people don't know that. So if you're over the age of 65, you're about 2 times as likely as someone who's not diabetic to develop a cataract. But if you're under the age of 65, it's closer to 3 to 4 times more likely. And it has to do with how long your blood sugars have been out of control. So it's a bit of a wake-up call for those who are suffering from diabetes, because when it comes to your vision, you don't want to mess around, right? So it can be quite scary because 88% of people actually classify vision as their most precious sense. And so when it comes to the eye impacts of diabetes, a lot of times that's when people take closer notice of the diabetes and figure, I really need to get it under control because I don't want to have it impact my eyesight. And the first thing people think about is sort of the retinopathies that occur with diabetes, where there's some leaking of the blood vessels and whatnot, but they don't necessarily connect the issue of cataracts with diabetes. And there is absolutely a correlation there. So now that I've kind of shaken your audience awake, we should talk about what a cataract is and what we do about it. So I've got my handy little model here, and we'll see how we do with the camera. Center it over. Okay, so this is a model of your eye. And so the light goes into your pupil. And if I just get my lens in proper here, if we go inside the eye, the light filters through that lens and hits into the back of the eye called the retina. And you can think of this like the film of a camera. And then the image is transported along the optic nerve to your brain for you to interpret it. And simply put, a cataract is this lens inside your eye getting cloudy or having opacities develop in it. So then the light just doesn't hit so nice on the camera, and therefore the image that you interpret to your brain is either blurry or dimmed, or the colors are not as vibrant. And so what does a cataract look like? Well, let's stick a cataract in this person's eye, and you can see instead of the lens being clear, they have a dislocated lens here. Let me just stick it in here. It's cloudy. And so imagine now the light's trying to get into your pupil and it's being blocked. And so you're just not getting the same amount of light in. Now, there's actually several different types of cataracts. But if we take a look, here's your clear lens. Here is sort of a typical age-related cataract. And then you can have other types of opacities as well. So it comes in many shapes and forms. Now, a lot of times people are not even aware that they have a cataract. In fact, there can be a lot of skepticism when you go and you have an eye exam and your eye doctor says you have a cataract. It's really common to hear, but I don't have any problems. I see fine.
Yes.
And that's because a lot of the types of cataracts are very slowly progressing cataracts. And so your threshold of noticing the symptoms kind of moves because you get used to it, and then it moves again and the threshold changes. And it's kind of like someone's taking a dimmer switch and slowly dialing it down. Right. And so oftentimes you don't even notice it until it's so apparent. And a lot of times after surgery, we get, my goodness, I didn't realize, like all of a sudden the colors are so vibrant, the sky is so blue. And that's because they just didn't realize how much impact that cataract was having on their visual life.
You know what, Dr. Marcella, you said something about people aren't even aware. As you know, when our seniors, they need to have their licenses renewed, they come back to us and say, no, I'm okay. And then when we do their visual acuities, I'm like, I think you need to go see Dr. Marcella, your optometrist. They're like, what? Yes. So it's important. And honestly, I love people here who have diabetes to make sure they do these visits to their optometrist every year. Sometimes you guys even bring them sooner than that.
Yeah. The typical protocol for people who have diabetes is to have an eye exam at least every 12 months, sometimes even every 6 months, or more often if there is some type of complication related to diabetes in their eye, because we want to be monitoring the progression. We can do a lot to help prevent the progression of the eye impacts by doing things like lowering the blood sugar levels, good diet, good exercise, all the things you're supposed to do, moderate movement, to control the blood sugar levels. Because what happens with diabetes and cataracts is there's sort of an oxidative stress within the lens, and the sugar content kind of rises in that lens and creates almost like an osmotic effect. And then it's like the little fibers of the lens sort of swell and then they can rupture. I mean, that sounds really horrible, but really what it does is create a bit of opacity within the lens. So the key is the sugar. And if we can control the blood sugar levels, you can help control the progression of something like a cataract and even the retinopathies that occur as well. So it's always better to prevent, right? But the cold hard truth is cataracts come, and cataracts can also be associated with other things such as age is a big one. In fact, I think that's kind of the misnomer, is everybody feels like it's an older person's condition. And it's not true. As I had mentioned before, people who are younger, let's say type 1 diabetics, who have suffered from diabetes their whole life, they're actually more likely to develop a cataract in their younger years. And, I have patients in their 20s that have cataracts. There are other things that cause cataracts, such as medication use. Steroids, for example, are sort of really known to cause a certain type of cataract. And people don't even think about things like nasal sprays that have steroids in them, or inhalers if you have asthma. So all of these things can create a situation where a cataract can develop, or just plain bad luck. So we can't label this as exclusively an older person's condition. Even kids can get cataracts, unfortunately. And so once a cataract is to the point where it's really impacting your vision, really the only thing that we can do about it is perform surgery to remove the cataract.
I know. You know what, Dr. Marcella, you are mentioning all these complications. Imagine when we are young, and of course you mentioned in the beginning, our vision is paramount. No one wants to be blind. And that's when we start seeing people with depression and anxiety, because there's sense of loss,
absolutely is. There's a grieving process that occurs when you're diagnosed with a cataract. So there's some very typical psychological responses to being given this diagnosis. You could be shocked because, again, you might not even realize that you have a cataract. You can be very scared because you're worried about, losing your vision. And you can be a little angry or resentful. If you're
Yes.
older, it's kind of old man age knocking on your door, reminding you. Or if you're younger, again, because of that misnomer that cataracts are an older person's condition exclusively, you're like, why me? You know, I'm so young. Why would I get a cataract? And that's really hard to digest. And the problem with our system is that you go to the doctor, you get your diagnosis of cataract, and then oftentimes there's weeks to months of waiting for your consult and then waiting for your surgery. And what happens in between then? You're going to start Googling, right? Because everybody does. They go on the internet and they start searching, and your anxiety levels go up. And you start realizing as well how many decisions there are to make with cataract surgery. Because Dr. Unada, we're living in an amazing time where there are so many technologies you can choose from to choose which implant to put in your eye. So let me back up a little bit.
I love it. Yes, yeah. I loved watching your videos, actually. You know,
thank you. Yeah, cool. You know, I have so much fun teaching all of this stuff. Let's talk about the surgery. Can we do that? Okay,
absolutely.
So let's put a cataract in the eye, first of all, because we're not necessarily going to do this on a clear lens for this show. Okay, so here's your eye, here's your cataract. And so what happens with surgery is we create a small incision near the colored part of your eye, and they go in and they remove this natural lens, okay? Right. And then they replace it with an implant. Now, here's what an implant looks like. Okay. Now, obviously, it's not life size, right? You can't cram this into my eye. Right, but this is what you're going to see through for the rest of your life. And it's comprised of two different features of the lens. There's the optic, and that's what you look through, you know, once it's in your eye. And then these are the haptics, the little arms that kind of hold it into place. Now, the truth is there's 100 implants on the market to choose from. And where they vary mostly is what's going on in the middle here. So you can have sort of a very typical implant that's just going to give you some distance vision, and then you'll need glasses for everything else. Or I don't know if you can see this on the camera. Can you see those rings in the implant there? Yeah, I can see. That's sort of a representation of a multifocal implant. And what's really neat about the technologies these days is you have an opportunity with your surgery to redesign your vision of the future. You can actually choose a technology that allows you to get distance vision and sort of a mid-range vision like computer and near vision, all with some independence of glasses. So people start realizing there's so many decisions to make with surgery, and it ties back to that anxiety because now there are so many choices to make. How do you make those choices? And that's what's going on.
A decision that's right for you, right? Yes. So tell me, Dr. Marcella, is it a permanent? Does it get damaged? Do you have to change it at some point?
Sure. Well, see, once it sits in the eye here, that's the implant sitting in the eye. I always joke it's going to outlast you. Okay, so the good news is once you actually perform the surgery, that's it. You can't technically get a cataract again because what a cataract is the clouding of your natural crystalline lens. So once you put an implant in there, they're made of different materials. Acrylic is one of the most common ones. And it's not something that degrades, or at least if it does, it's going to be hundreds of years from now.
Oh, that's wonderful.
Yeah, so that's the good news. I mean, it's pretty much a one-time deal. People might have heard the term secondary cataract, and it's actually a misnomer. It's just actually some protein buildup that kind of builds up on the skin on the back of the implant. So it's not a true cataract per se, and that's just dealt with laser down the road. So more of a nuisance factor down the road. But for the actual cataract itself, this is a one-time deal. Okay.
So tell me, Dr. Marcella, do they pay? Is it privately paid, or
it depends on what jurisdiction that you're in. So every, healthcare system has their own way of dealing with something like a cataract. So in Canada, for example, if you have a true cataract, then the procedure itself is covered under healthcare. Okay, and it's provincially regulated. So there's different eligibility parameters to be considered eligible to have it under the health insurance. If you're in the US, for example, your health insurance may cover it as well. But again, with either system, even in the UK, they have NHS. With any of these systems, there's sort of a minimum amount of vision loss that you have to sustain before they consider you eligible for surgery. And I really wanted to touch upon that because there are also opportunities to go through this from a more private pay perspective. So for example, if you don't quite meet the eligibility requirements for whatever system you're under, and you're still feeling like you're bothered by the symptoms of a cataract, then certainly you could have an opportunity to have the procedure, but you get the honor of paying for it.
Right. Oh yeah. It's always the case, right? And
yes.
I mean, the wait game, this long queue. I have had patients telling me they've been waiting for 12 months.
Yes.
It's long, and that's usually the case with free healthcare. So tell me, any other causes of cataract you've seen other than diabetes? I know it's the commonest, right? Actually, I was surprised in Canada, 1 in 3 people have diabetes or pre-diabetes. And of course, as we both know, globally, what is the number 1 cause of heart attacks? It's due to heart-related or diabetes-related complications, right?
Yeah.
So what else do you see, like the other causes of cataract?
There's definitely an age correlation for many of the cataracts. So the older you get, the more likely you are to have it, because our bodies have sustained so much environmental stress, oxidative stress, free radicals, you name it, plus whatever other health conditions you may have. I touched upon, certain medications can cause cataracts, such as steroids. Even a trauma can cause a cataract as well. So, for example, if you were hit in the eye with a baseball when you were a child, then decades later, that can actually come in the form of a cataract. And sometimes we don't really know why a cataract develops. So then we call those ones the bad luck cataracts, right? There are several different types of cataracts. Some of them just cause that yellowing of the lens. Some of them, there's sort of little opacities within the lens. There's even cataracts called snowflake cataracts and Christmas tree cataracts. And they're beautiful to look at. So I at least have a moment to admire them, even though it's a devastating diagnosis for someone who's on the receiving end of it. But the good news is that the surgery is quite effective in managing a cataract, right? And so that anxiety that comes with the diagnosis of something that's potentially threatening your vision, a lot of that anxiety is coming from the what ifs, right? The what if my vision declines? What if there's a complication from the surgery? And so my advice to your audience would be, the first thing you should do when you're diagnosed with a cataract is start to get educated on it, okay? Because I hear it time and time again. First of all, the surgery itself, everybody's freaked out about having surgery, and they spend months leading up to it because they're either on a waiting list or, just getting through the system to get to their surgery date. That's a lot of time for your thoughts to be percolating around, and you can really build it up. So I have a Facebook support group called Preparing for Cataract Surgery Support Group. And in it, last week I posted... I'm going to forward it to my community. Oh, that'd be wonderful. Yeah, everybody's welcome in it. What I posted last week on it was a little GIF, I guess you call them, of a little dog in a Santa suit. And I said to them, as a kid, the months leading up to Christmas Day and the anxiety and the anticipation for that big day, and then it's all over in 15 minutes, that's cataract surgery. That's what happens. Yes, I know. Yes, yes. Yeah. You know what? Actually, it was recently, though, it was funny. One of my patients, 2 seniors, they were going for their cataract section, and they were both going for it, and they were going to drive back home. How is your vision after cataracts? I was like, that was risky. But fortunately, the other one didn't qualify because of his high blood pressure. We wouldn't recommend having this as a couple's retreat. The truth is you shouldn't be driving. There's actually several reasons not to drive initially after your cataract surgery. One of them is the medications they give you to calm your nerves makes you a little loopy-doo, so you don't want to be driving. But also, we don't know what your vision is going to be right after surgery. It can be quite foggy. So yes, once you go for surgery day, you definitely want to have a driver take you home. Yes. So how long does it take for them to go back to driving after your cataract surgery? You have to meet a certain driving requirement to be cleared for driving, and your doctor will typically do this. It can be as early as 24 hours after surgery, or it can take up to a week or sometimes even 2 weeks, depending on how long it takes for you to get a functional set of vision. And that's another point, Dr. Renati, because a lot of people think that they're going to go in for the surgery and it's going to be this miraculous thing where they walk out and they're perfectly clear. And for many people that actually occurs. But when it doesn't happen like that, then talk about ramp up more anxiety, because you're like, well, wait a second. The guy beside me thinks he's 20/20.
Yes,
Yeah.
I actually recently, she told me she went back to the hospital. She was examined even by another surgeon, and he said, all is well, we're good,
Yes.
give it time. But she was really anxious because she travels.
Yes.
And she said, I cannot not afford, I can't afford not to see where I'm going. So you're
Yeah.
right, it brings a lot of anxiety. And you know what? Actually, this is eye-opening for me too, to really take time to educate my patients and spend more time in the psychosocial aspect of it. Because usually we say, you know
Yes.
what, I see you have a cataract, I'm just sending you to an ophthalmologist. We think it's just an informal referral like that, but you're right. We need to
Well,
prepare our patients.
and it's true because Dr. Natty, you and I see cataracts on a daily basis. So we're desensitized from the fact that with that
Right.
limited interaction that we have with the patient in their chair, we talk to them about the facts, what a cataract is, how to fix it. And the question is, who's helping them when they go home? Right? When they go home and have all those thoughts and those questions and everything. And certainly they can call their doctor and get advice and whatnot. But it's when you're laying there at night and you're starting to think about things.
Yes.
Yeah. And even before surgery, it happens. After surgery, it happens. So if there's one thing that your audience takes away, that is to understand that the cataract journey is a journey, and it starts at the moment of your diagnosis, because you have a whole slew of decisions you're going to need to make about your technologies that you use on how to do the surgery, whether it be a laser assisted surgery or a traditional method. You're going to need to choose which implants that they're going to put in your eye, because there's always an implant being put into the eye.
Right.
And also the journey afterwards. Although the acute healing phase is about 3 to 5 days, it takes 4 to 6 weeks for that lens to settle in. And in the meantime, there are some really funny things that can happen with your vision. And so you have to kind of forgive yourself that you're not going to be at your top performance 5 days after surgery. You just had surgery on an organ of your body. And it takes some time to not only heal physically from that surgery, but we need to retrain your brain as well. There's something called neural adaptation. So imagine like when you buy a new pair of shoes and you stick it on, sometimes they take a while to kind of settle in, right? and have you feel comfortable in those shoes. You got to break them in. And it's really similar with cataract surgery, especially if you go for some type of premium implant that gives you that greater freedom from glasses. We're all looking right after surgery, is it better? Is it better? And when it's not better, then you get scared. Is this normal? Is it abnormal? Did I pick the wrong lens? And all of this stuff goes swirling around your head. And the truth is, we have to wait for the physical healing and the neural adaptation. And that is the brain catching up to this new visual system and filtering out all the junk light rays that are coming into the eye and learning how to use and function with the new implant.
That's powerful, Dr. Marcella. That's powerful because, to be honest, thinking of specifically of this one lady, she kept going back within that 6 weeks period. It was probably 2 weeks or 3 weeks after she kept going back to the hospital. I think it's powerful for us to communicate that with them, because sometimes, after surgery, patients don't necessarily see the surgeon, you are looked after by other people in the recovery room. So those are the little things that are important so that we can lessen that anxiety. Thank you. I'll do that also as I educate them going for surgery. Wow, I love it. I don't want to let you go. So tell me, for the young people, who is looking after them afterwards? Because it's interesting that I've never had a young person with with complications from diabetes. After this, do they come back to you guys, like with the optometrist, to go through? Because I feel guilty now that I've never really sent any of them for counseling or anything. Do you guys do that at your optometry clinics, or who does that?
So I just need to clarify that for my particular role, even though I'm an optometrist, I work in the surgery center. So my role with the patient will be post-diagnosis. The optometrist in their primary care practice diagnoses the cataract, and then they refer into the surgery center, and then I can help with the workup and talk about the various risks and benefits of different implant types. And then the surgeon performs the surgery, and oftentimes then they come back to me for the post-care or their local optometrist. So I think what you're asking is, what about the longer term care? And since the theme here is both cataracts and diabetes, I think we need to acknowledge that there has to be ongoing care, ongoing vision monitoring, because there is a potential linked to progression in any type of retinopathy if you have a cataract and you do your cataract surgery with diabetes. Now, that should not deter you from doing the cataract surgery, because in fact, there's a tendency now that if you have diabetes and you're diagnosed with a cataract, that you might want to have your cataract surgery earlier in the process, because your retina might be in better shape to withstand the surgery, as opposed to waiting as long as you possibly can until that last minute. And in the meantime, behind that cataract, there are changes from diabetes occurring. And sometimes if the cataract gets so dense, we as clinicians have an even harder time detecting those subtle changes. So we can't fear the surgery. If your doctor is recommending that it's time to do cataract surgery, it may be more than just because of your vision as well. It could be because they know that you're in a healthy state right now and that you're strong enough in your eye health to go ahead and withstand the surgery itself.
Yes.
Right?
You know what? I asked that question specifically, Dr. Marcella, because I tend to see my younger diabetics, the type 1s. I mean, not all of them. They tend to be non-compliant. I don't get to see them, but now with the COVID-19, I'm tracking them down to come, because now I'm wondering, okay, I'm hoping you're seeing them, because a lot of them have a year's supply of their insulin. And they would give me that reason that, no, doc, I'm good. I have my year's supply. I got it from my endocrinologist. But I'm just hoping they don't get lost in the system. Are they coming to see you guys? Are you seeing lots of them coming in? Because, I mean, the old folks would come in, but the type 1s, I'm concerned about those young people.
Sure. I mean, for us, because we're in the surgery center, we get them at the point where the cataract is already developed, right? But in the primary care setting, it really is incumbent upon the clinician to be very proactive in educating the patient on the importance of ongoing monitoring, and especially if they're insulin dependent. Again, another risk factor when you add that in terms of developing complications such as cataracts. And so, it's so important to have ongoing monitoring, regardless of if you have a cataract or not. It should be every 6 to 12 months for the diabetes progression. And you're right, you said something that really hits home, and that is, a lot of times, especially if you're younger, you think you're a little invincible, maybe you're a little more lax on your blood sugar levels. And then you get the wake-up call. You get a diagnosis of something going on in your eye. And that's often the impetus for them to kind of sit up and take notice and go, oh boy, like, okay, this is real, because vision is tangible, right? When you start talking about leaky blood vessels in the body and you can't see it happening and you're worried about other organ implications with having diabetes, it's more of an abstract concept that, it's not really in your face, right? But vision is. And so when suddenly you're not seeing as well as you should because there's something going on, that's usually what kind of shakes people into looking at, okay, I need to get a little bit more compliant with my glucose control. And that's a lot of times when they start getting onto the forums and go to the diabetes, support groups and those type of things. So, I think what our mission is to tell people to do it before something like your vision is being threatened.
More preventive, I'm actually loving there's this new device people are putting on their arms, and they can use their cell phones to check their diabetes.
Isn't it cool what we can do with technology?
I know, right? But it's still expensive. Not everyone can afford it. But I mean, it has made a humongous difference, because my younger patients specifically, or maybe truck drivers, right? They say, I can just use the tap and I don't have to be poking myself. So things are advancing, I'm really loving this. You know what, Doc? We're going to close. I don't want to. So tell me, how can people, I know that we are watched actually by people, also my community here in Calgary. Where is your office, your offsite programs?
So I happen to work at a cataract surgery center, but what I really want to know, because this is really a global audience, we should really invite them into my more global forums. As the CEO of OSITE programs, I offer a free Preparing for Cataract Surgery support group on Facebook. So they can just look me up on Facebook, just type in Preparing for Cataract Surgery support group, and you can be invited into the group where I do things like Facebook Lives, which, by the way, it's a good time to join because I'm going to do one next week, and I'll be able to answer all your questions about cataracts during that. And also, as you go in there, you'll be invited to a free Preparing for Cataract Surgery 30-minute masterclass. And what I go through with that is exactly what a cataract is. I'll show you some animations. I'll talk about the surgery, I'll give you sort of a quick lowdown on the different groups of implants that you can choose from. And then I want to talk to you about something that I think is your number one challenge as you prepare for cataract surgery, and that's called the paradox of choice. So that's a little teaser. Go to the class and watch the class, because I'll teach you how to overcome it, just to make that pre-surgery journey just a little easier. Plus, I help you prepare for the actual big surgery day. So the first step would be to go to Facebook and search the Preparing for Cataract Surgery support group.
Loved it. And actually, I'm going to join too. I honestly feel honored to have actually had you here, because you have opened my eyes in terms of also spending more time and talk about cataract preparation. It's not just saying, hey, I can see you have cataract, I'm sending you. I think the fear of the person leaving your office, I've never thought about it. And I honestly think a lot of my colleagues don't either. So this is an honor. And also, I'm so blessed to have brought you here to open my eyes, to take time on that aspect.
And just to know that it's a journey for them. It's a journey, and it's a months-long journey heading not just to the surgery day, but beyond. It's months beyond that as well.
Yes. I mean, for me, it was an eye-opener when I had that specific patient I was talking about. She said 2 times she went back, because she said, I don't want to lose my sight. Now I regret going. Some of them regret going in, right? Because things don't go. So tell me, again, before we close, the lens, does it ever move? Because I've had patients saying, oh my gosh, I'm scared. Will it ever move? I saw you showed us the horns. Yeah.
Right. So the lens itself, if I can find my little lens, where is it? Okay, so the lens itself sits in the lens bag inside your eye. So it's very rare for it to actually rotate or sublux out. It would require a trauma or something real extenuating circumstances. For the most part, after that first 4 to 6 weeks of kind of settling in, you can pretty much live your life and not worry about it, okay? Because it's really stable in the eye. Certainly you can have a trauma, a car accident maybe can do it if the airbag hits you in the wrong way. But these are really few and far between incidences. So generally speaking, after that initial healing period, I just encourage people just go and live their life with their new vision of the future.
I love it. You are awesome. I'm bringing you back because I would like us to talk about autoimmune diseases and eyes, because I do see the complications. Yes, absolutely. To our viewers, thank you so much. I can see people are still staying with us. Thank you so much for staying here with us. Happy Easter for those people who enjoy or celebrate Easter. I'm actually reminded of my childhood story. I remember one of my grandparents was a story writer, and we used to act actually this whole season. So it took me back to my childhood memories. Next week, we're going to be here, same time, same place. I want to bring another speaker here. I bring all these wonderful thought leaders to teach us and open our eyes. I'm also learning from them. I'm so blessed to have started this. And if you are not aware of this, it's coming from Facebook, YouTube, and LinkedIn. Make sure that you click that like button and share. Invite more friends, more families, and of course, happy Easter, everyone. Dr. Marcella, thank you so much for your time.
Thank you. Bye. Happy Easter.
Enjoyed you. Yes, absolutely. I really enjoyed you. It's a pleasure. Thank you so much, and take care.
Okay. How do I sign out?